Hi guys, in this video I want to talk about the comprehensive management of iron deficiency anemia. Before I start, let's know what anemia means. Anemia means the decrease of blood cell, RBC. RBC means red blood cell in the body. So red blood cell help for the transportation of oxygen in the body. Now, if there is decrease of RBC in the body, which cannot facilitate the transportation of oxygen in the body, then you know we are in a big trouble. For example, if you close your nose and there's no oxygen going into you, then you know you get into a blackout stage, and that is very crucial. That is why God created the oxygen for we. Alright, so it's very crucial that we have oxygen to our body. Oxygen will enter into our lungs, but the RBC have to exchange with the oxygen and transport it into the body. And if there is no sustainable RBCs in the body, then we'll be having that issue of blackouts, and it's not a good issue. So now we know what anemia is. Now, what is iron deficiency anemia? Iron deficiency anemia means that there is a production of iron because RBC contain iron, right? So this iron this RBC contain has to help. It's the main source of hemoglobin, and it helps transporting the oxygen in the body. So now if there is no production of this iron, then we are in a big trouble. You get the point now. So if there's no production of iron, then we are in a big issue. So now we know our anemia, we know iron deficiency anemia. What is the signs and symptoms? Because you can't go and start giving management without knowing the signs and symptoms and the causes. These are very crucial before you go for your management, right? So what is the signs and symptoms? Number one signs and symptoms is a discoloration of your body. Your body will be discolored, all right? We can be discolored in the form of jaundice, or we can be having a bluish discoloration in the fingers. There will be brittle fingers. I don't know how to explain. You can just Google that to know more about it. And we'll be having discoloration in aspect of your tongue, your eyes. All right. Apart from that, we'll be having a soreness in the tongue, and we'll be having symptoms like fatigue, weakness, or we'll be having dizziness. Some symptoms like that is symptoms of blackout, all right? And apart from that, we'll be having increased heart rate because our heart is trying to compensate the iron deficiency anemia in the body. Like for example, when there is no blood in your body, your heart will be trying to pump the little it has just to sustain the people who are calling for blood. I don't know, you should get the point, alright? So that is point number 2. Now let's go down to causes, because we have to know the causes of iron deficiency anemia before we get to the management, which is very crucial. Without knowing the causes, we can't get there. So what are the causes? The causes of iron deficiency anemia can be caused due to loss of blood. Number 1 point, loss of blood occurs in different way. We can be having a bleeding which is uncontrollable, or we can be having hernia, which is a swollen part of our body, and if it bursts, there will be blood that will be lost. Or we can be having loss of blood in such like peritonitis, some condition in the body, and etc. Alright, that is another point we should put in mind. And a very crucial one, menstrual period. Most women suffer from iron deficiency anemia. We should put that point very where in our mind. We should remember that point, all right? Apart from that, pregnancy. Women who are pregnant are more susceptible to iron deficiency anemia compared to the rest of us who are not pregnant. So pregnancy plays a very big role when it comes to anemia. Alright, so how does it occur? Because of women, we eat as a human being. I eat, and the food I'm eating, the diet which is coming to my mouth and going to digestion, it produces iron, alright, for my blood cell. But I eat, and the iron only help me as an individual. But when it comes to pregnant women, they are feeding themselves with their iron, and at the same time their iron is going to their fetus. So if they are having this iron deficiency anemia, what they have to do is to boost their iron supply so that they can feed both individuals. They are feeding themselves and they are feeding the production of their baby in the body. That is on that point. Now, coming from that eating point, there is diet. Diet can play a major role when it comes to iron deficiency anemia. If you're not having the adequate diet which is required, like I said, for pregnant women, then you'll be having iron deficiency anemia. Now, coming from that diet point, we have another condition. Some conditions are there: inability to absorb iron in the body. Some people are like that, all right, so they need some medications to help them, or some underlying causes which is causing that effect. So we have to help flush out this iron deficiency anemia and restore them to normal daily activities. Now, after that, now let's talk about the diagnosis of iron deficiency anemia. I know I promised you the management, just sit and relax. Why diagnosis is so crucial? This is because you can't just conclude looking the symptoms, looking everything I've told you about symptoms, looking about the causes. You can't just conclude, because most times, some cases, there is a what we call differential diagnosis. Differential diagnosis simply means that somebody can be having this kind of symptoms, this kind of causes, but it could be a different illness. All right. For example, people who have HIV, they used to have fever, and at the same time, people who have monkeypox virus, they used to have fever. At the same time, people who have osteomyelitis, people who have fractures, they used to have fever. So now, fever is one symptom, but different conditions. So that is why we like doing this diagnostic. So if you want to do your diagnostic, you can go to your medical professional and they will do the diagnostic in lab. There is different diagnostic you can do, especially RBC counts. You can count the RBC. There is a limit where they will go and they will know that you're having iron deficiency anemia. But if the count is better, they will tell you you're better. And you can do hemoglobin count, and there are different numerous counts out there which we can use. Now, down to the comprehensive management of iron deficiency anemia. What should we think in mind? Now, before you go to the management, now think about the conditions, right? If your diagnosis have concluded this person is having iron deficiency anemia, then look from the causes and ask yourself, which side am I having issues? If you're having issues in the bleeding, your doctor can control your bleeding. They will give you some medications which will help you prevent bleeding from coming. Or if you're having menstrual issues, they will boost your diet, or they will give you some medications to boost your iron in your body, which will help in production of hemoglobin, and that can prevent it. Especially for pregnant women who are sharing their iron, then they will boost their iron, and they most times give advice to increase the iron that is being fed to a pregnant women, or especially those who have given birth recently. Their iron and their feeding used to be increased. And apart from that, if you're having inability to absorb iron in your body, they can rule out the medical condition and eliminate this medical condition which is giving you inability to absorb iron in your body. And the last but not the least, if you're having diet issue, you have to work on your diet, and there are different diets you can be recommended. So like increasing your vegetables, eating egg, eating meat, and etc. This helps in iron production, and you can get some advice from your medical doctor, and they will tell you on how to manage your iron deficiency anemia. Thank you for watching, guys, and have a very nice day.